Every year, hundreds of thousands of people wake up from gallbladder surgery believing the problem is solved. The organ is gone, the pain is gone, and most surgeons send them home with a simple message: you don't need it anyway. But years later, many of these same people start noticing something strange. Digestion feels different. Certain foods that never bothered them before suddenly cause bloating or urgency. Some develop pale, floating stools. Others notice their cholesterol creeping upward for no obvious reason. Nobody warned them this could happen, because nobody explained what the gallbladder was actually doing in the first place. To understand what changes years after removal, you first have to understand what this small organ was built for. The gallbladder doesn't produce bile. The liver does that. What the gallbladder does is store and concentrate that bile between meals, then release a strong, concentrated dose the moment fat enters your digestive tract. That timing matters. Bile isn't just a digestive fluid, it's an emulsifier. It breaks large fat globules into smaller particles, so enzymes can actually get to work. Without efficient bile release, fat digestion becomes sluggish, and so does the absorption of everything that depends on fat to be absorbed, including vitamins A, D, E, and K, along with omega-3 fatty acids and plant compounds like the carotenoids found in vegetables. Once the gallbladder is removed, that storage and release system disappears. Bile still reaches the small intestine, but instead of arriving in a concentrated burst timed to your meals, it now drips in continuously, in smaller amounts, regardless of whether you're eating or not. For some people, the body adapts reasonably well. For others, this shift creates a slow, quiet imbalance that builds for years before symptoms become obvious. One of the most common long-term issues is something doctors call bile acid diarrhea. Because bile is no longer stored and released in a controlled way, excess amounts can end up flooding the colon, especially after fatty meals. This irritates the intestinal lining and speeds up transit time, which is why so many post-cholecystectomy patients report sudden urgency, loose stools, or unpredictable bathroom trips years after their surgery, often with no clear explanation given by their doctor. On the opposite end, some people end up with the reverse problem: not enough usable bile reaching the intestine at the right time. This shows up as pale or floating stools, a feeling of heaviness after eating fat, and gradual deficiencies in fat-soluble vitamins. If you've had your gallbladder removed years ago and you've started struggling to see clearly at night, or your eyes feel persistently dry, that can point toward low vitamin A. Brittle nails, fatigue, or bone density concerns over time can reflect low vitamin D or K. These deficiencies don't appear overnight. They build slowly, which is exactly why so few people connect them back to a surgery that happened years earlier. There's also a quieter shift happening inside the gut itself. Bile isn't only involved in digestion, it also has antimicrobial properties that help keep bacterial populations in the small intestine in check. When bile flow becomes irregular, some people become more vulnerable to small intestinal bacterial overgrowth, a condition where bacteria that should stay confined to the colon begin multiplying further up the digestive tract. This can produce chronic bloating, excess gas, and a sense of fermentation after meals, symptoms that are frequently misdiagnosed as general, sensitive stomach issues, rather than traced back to bile changes. Then there's cholesterol. Bile is one of the body's primary routes for clearing excess cholesterol. When bile regulation becomes inconsistent after gallbladder removal, some people notice their cholesterol levels shifting over the following years, even without major changes to their diet. Research has also looked at links between cholecystectomy and non-alcoholic fatty liver disease, since bile plays a role in how the liver processes and exports fat. This doesn't mean surgery guarantees liver problems, but it does mean the liver may be working under slightly different conditions than it was before. The pancreas often gets pulled into this picture too. The gallbladder doesn't function alone. It works alongside the liver and pancreas as part of one connected system. After removal, some people find their pancreas compensating for changes in digestive timing, and this can occasionally show up as referred discomfort, sometimes even felt on the opposite side of the body from where the original gallbladder pain used to be. If stools become dark, sticky, or difficult to clean, That's often a sign of reduced pancreatic enzyme output rather than anything related to bile at all. And it's worth mentioning to a doctor rather than assuming it's just a normal after effect of surgery. So what can actually be done about all this? This is where most explanations stop short, but the practical side matters just as much as understanding the mechanism. For people dealing with bile-related diarrhea, certain fibers bind excess bile acids in the gut and can meaningfully reduce urgency. Psyllium husk is one of the most studied options. Pectin, found in the peel of green apples, along with steamed vegetables like okra, beets, and kale, can also help bind and regulate bile in the intestine. A quality probiotic can support the microbial balance disrupted by irregular bile flow. For people on the opposite end, dealing with insufficient bile, reaching the gut at the right time, supplemental ox bile taken with meals is a commonly used approach, typically starting around 1 to 2 capsules after eating, though the right dose varies from person to person and should be adjusted with guidance from a healthcare provider. If pancreatic enzyme output seems to be the issue, based on those dark or sticky stools, a pancreatic enzyme supplement taken with meals can support proper fat breakdown. Choline deserves particular attention here because it's one of the most overlooked pieces of this entire picture. Choline helps prevent cholesterol from crystallizing into the sludge that eventually becomes a gallstone in the first place, and it continues to matter for liver and bile health even after the gallbladder is gone. The uncomfortable reality is that a significant portion of the population doesn't get enough choline from diet alone, and some people carry a genetic variation that increases their choline requirement even further. 2 eggs provide a meaningful percentage of daily choline needs, with the rest typically coming from seafood and to a lesser extent liver. Athletes, people under high stress, and anyone consuming alcohol regularly tend to need more choline than average, not less. None of this means gallbladder removal is a mistake, or that everyone who has the surgery is destined for years of digestive struggle. Many people adapt well and never think about it again. But for the people who don't, the missing piece usually isn't bad luck. It's a lack of information at the time of surgery about what the gallbladder was actually doing and what the body has to compensate for once it's gone. Nobody sits down with these patients and explains that bile flow changes permanently, that fat-soluble vitamins need more attention, that fiber and choline intake become more important, not less, or that certain symptoms years down the line are worth connecting back to a surgery that already feels like old news. If you've had your gallbladder removed and you've noticed digestive changes that never quite resolved, the explanation likely isn't in your head, and it isn't something you simply have to live with. It's a downstream effect of losing an organ that concentrated and timed one of the most important fluids in your entire digestive system. Understanding that is the first step toward actually addressing it. Whether that means adjusting fiber intake, supporting bile with the right supplement, paying closer attention to choline, or simply asking your doctor the right questions the next time something feels off. The surgery may have removed the organ, but it didn't remove the need to understand how your digestion works now. And that understanding is what actually changes how you feel. Years after the operation that was supposed to be the end of the story.